Thank you, and thank you for that introduction. I'm very honored to be here, to be the one to talk to you about exercise. So in terms of the outline, what I will discuss today is I'll talk a little bit about the importance or what role exercise can have in the management of end-stage kidney disease, or ESKD. As I was asked, I will talk about the efficacy or some of the evidence to support its use in management, as well as the evidence around the adoption of exercise and how to get people to take part. And finally, I'll talk about some of the existing models of exercise delivery in renal care and how we can improve upon those models to have a greater health impact. So in terms of what role exercise can have in the care of somebody with ESKD, I think we can appreciate the quality of life is tremendously affected by not only the disease itself, but also treatment. And that's the effect on the physical, the emotional, and the social functioning. And the magnitude of this has been conveyed several ways. So it's true that people with ESKD scores on their quality of life have been ranked similarly to people who have metastatic cancer. Also, somebody with 10 years of life on dialysis would trade 4 years of that life for normal kidney function. So that conveys what an impact this disease has. Physical function is a component of quality of life. And so when I say physical function, I mean the sort of the physical tasks that you need to remain independent to keep you functioning in your role from the day to day. We know that there's an association between starting dialysis and losing function. This is a slide from a study in about 3,700 people in the US who were nursing home residents who started dialysis. And this slide, the study is actually from 10 years ago, but it's very relevant today because the fastest growing age group starting dialysis is age 75 and older in developing countries. And what it shows, you can see on the vertical axis, physical function, and that's represented as activities of daily living, with higher scores being worse. You can see on the horizontal axis time, and that dashed line represents when dialysis is started. And you can see that that blue line decreases sharply around the initiation of dialysis. And we know that that's independent of how old somebody is, their gender, their ethnicity, and also how they were doing in terms of their physical function before they started dialysis. So what this tells me is that as dialysis healthcare providers, that this very much is something relevant to the care that we provide, that we need effective treatments to address. And certainly, as was alluded to in the introduction, research with patient and carers has been very helpful in understanding what priorities are relevant for patients and caregivers. And those are related to quality of life and symptom burden. And this has been quite important because, as we know, in the past, patients haven't been included in deciding what is important in terms of the research agenda. Typically, that has been left to experts. So it's been very formative because there is a discordance. And as shown in the first example there, the patients and carers who were involved in that study, they mostly identified research questions related to symptom burden as things that needed to be addressed. So 6 out of 10, the top 10, were related to treating symptoms. Also on that list was an interest in exercise. So it's important to know how we can fit those two together to meet this priority. So what do we know? So exercise and research, the first trial in exercise was actually in the 80s. So we have been at this a while. The largest body of evidence, though, is really for knowing that exercise can improve the physical components of quality of life. So how you see yourself functioning in your day-to-day. And we know we can tell people if you want to do aerobic exercise or resistance exercise or both 3 times a week for about half hour, that is associated with some appreciable change in your physical quality of life.
I'm Emily from Anne's Data.
We also know we can make people stronger,
Yes.
typically by lifting weights. And a lot of that has just been done with ankle weights during the dialysis treatment. We know we can make people fitter, and the common mode of that is having people cycle during dialysis. We know we can help people walk further, and that is relevant for helping people shop and keep up with their spouses, is what we often hear in our exercise program. I did put that final bullet there, the PEDAL study I wanted to mention, because it is a bit exceptional in terms of exercise studies. As I say, we've been at this for 30 years, but we typically have very small studies. And this study is a multi-center study of over 300 people on in-center dialysis, looking at whether cycling during the treatment can improve aspects of quality of life. But not only that, is it acceptable and is it cost effective, which I think is a very important question to be able to come to payers with if we want to adopt this into our units. I mentioned the importance of symptoms and addressing symptoms. So what do we know about this? And this was recently reviewed by my Canadian group. We have a review that is in press that looked at studies that have evaluated the effect of exercise on patient-reported outcomes, so things like symptoms and disability. And what we found is that there are studies to support that cycling during the dialysis treatment can help improve restless legs, which is often a big problem for people receiving dialysis and sometimes reasons why they cut the treatment short. So 3 times a week for 30 minutes was the typical regimen. There's also some evidence to suggest that exercise during dialysis, whether it's on a bike or using some weights, can improve aspects of depression. But really, there's a lot more work left to be done. There were 25 studies that we found, which sounds like a lot. But of those 25, only 5 really focused on a patient-reported outcome. So, and the rest, they were just sort of on the long list of secondary concerns. So there certainly is room to figure out how we can improve fatigue, as you'll hear about later, but also other things like sleep and cramping that are significant symptoms. So where are we now? How is this evidence over these decades translated to clinical practice? And I will say, despite the evidence that I've just shown, dialysis-based exercise programs do remain the exception rather than the rule. So these are some pictures from my own program in Edmonton, and we do provide bike and weights during dialysis. But like I said, these are few and far between. We're aware of some programs in a few other provinces in Canada, Mexico City, Portugal, Germany, but they really are quite rare. Programs that are off of dialysis are even rarer. And so we have to think about this, though, in the context of other chronic disease models like pulmonary rehabilitation and cardiac rehabilitation, who've clearly defined where exercise belongs in managing their disease. And it is standard of care. And so perhaps not unsurprisingly, people with kidney disease are not as active as people who have normal kidney function. So in this Canadian survey of over 400 people on dialysis, both home and in-center, only 25% believed that they could exercise without difficulty. And the biggest difficulty was fatigue and shortness of breath. And so how did we get here? I think that part of the issue of why exercise has been hard to adopt at the individual and the program level is that we always look at it when we study it very simply. It's actually a very hard thing to do. It's a behavior change. We tend to just think of it as putting a piece of equipment in front of somebody and then measuring how outcome X is improved. But we really need to start thinking about how to talk about exercise constructively and then how to implement programs that are much more sustainable and that people want to do. So let's talk about motivation. So there have been a number of qualitative studies that have looked at the barriers as well as facilitators to doing exercise, and typically it's exercise in the dialysis unit while people are dialyzing. That's the most common model. And those studies have been pretty consistent when they report barriers. So on the patient side, the things that keep coming up are symptoms. You know, I feel too tired to exercise. I'm already short of breath. What also comes up, though, is I don't know what to do, and I don't know how to do it, and I don't have support. But what does also come up is that patients are interested. Over 90% of patients in these surveys would say they would be interested in hearing about exercise or would exercise if advised to do so. But on the physician side, some of the very common barriers are the perception of not having time, it not being as high a priority, not knowing what to recommend or how to prescribe exercise, and also the view that patients are not interested. So what we're sort of left here is a stalemate where nothing's really progressing. So what can we do? What can we do to move the gap, to move this and close this gap and get people interested in exercise and being able to recommend it constructively? So I'm going to say a few things here, and I'm going to make a generalization. I think that as medical people, we're not very good at talking to people about exercise. Okay, would anybody agree with me about that? Okay, fair enough. We tend to say things like, exercise is medicine, which isn't appealing, actually. It's not appealing. Or, you could decrease your risk of mortality. I mean, that is just not motivating. So really what we need to do is, we need to take note of what other corporations have done. We need to make it look good. We need to make it look fun. We need to emphasize the instant benefits. And what do we know about why people with ESKD might want to exercise? They want to be stronger. They want to feel less fatigue. So that would be my first piece of advice, would be to emphasize the immediate benefits. And this is for providers speaking with patients. I think that when patients are looking for advice on exercise, that it should be individualized, and that should be what we try to seek out and where we should set the standard. There are some online resources, which I'll show at the end, but really, if somebody hasn't exercised for a long time and they have a chronic condition, you do need a little bit of personalized advice about where to start. And you need an exercise professional. You do. You need a physiotherapist, you need a recreational therapist, or you need a kinesiologist. We also know that that is one of the factors associated with a very successful program. And I know that funding is tight, but I think in most developed countries, at the risk of sounding overly simplistic, there's always money for the important things. So if this is something that is important in the unit, to really advocate for it. The next thing that can be helpful is incentivizing exercise, and this also speaks to having a professional. I don't necessarily mean monetarily, I just mean with goal setting and having that personalized approach. When we have our dialysis program in the unit, it gets boring cycling even 3 times a week doing the same thing, so we try to do competitions, we do challenges between the patients and the nurses, our unit and other units, and so on. And finally, like I said, I think patients have a lot of pull, and we're really seeing the research landscape change because of the involvement and input. And I think the same case can be made for care. If there is a perception that you're not interested and you are interested, just to make that interest known. So I've talked about a culture change, which is exercise in the dialysis unit. But in terms of having a bigger impact, what is the next culture change? And what I'd like to talk about is actually using other opportunities to really get people involved. And if fatigue is a barrier, how can we address that barrier to get people to exercise? So one suggestion is to include it in a weight room intervention that takes place in the weight room. So if people are already coming into the in-center context and waiting for their treatment, during that 15 minutes, is there something that we can teach patients about managing fatigue that will go along and help them exercise? Because those two tools should probably go together if that's the barrier to exercise. And Nancy Verdon, she is an occupational therapist. She's had her own experience with ESKD. She lives in Calgary, and she's a researcher, and she's designed a short program for the waiting room to help people manage their fatigue. And it has to do with prioritizing your tasks, being able to seek help, and also respecting your fatigue, but so that you can manage your day to get the important things done. And that needs to go hand in hand with exercise. The second thing is these assumptions that we make about where people with ESKD want to exercise. We need to elicit preferences more. And what was surprising was that in that study that I talked about before, in those 400 people on dialysis in Canada, 75% wanted to exercise at home. So that's probably not surprising, but to me it actually was surprising because we've been so focused on doing this thing during dialysis. So how can we then incorporate existing home strategies with home care or home physiotherapy to make this happen? This is really relevant for people who dialyze at home, who have been really neglected from all of these exercise trials. We want to improve functioning at home so that they can stay there. And finally, sustaining. That is going to be the biggest challenge with any exercise program, regardless of what population you are in. So how can we make it easy to sustain this behavior? Well, we know that ESKD is isolating. So can we create a social network? Can we create some sort of peer support group that is based on exercise, but we're also providing this connection? Because that will be what keeps people coming back. It won't be education. It won't be rational thought, because we're not rational beings. It will be that we can provide something else for people that is meaningful and not make exercise a chore, which it can be. I wanted to talk a little bit about Nicole Jefferson, who is a patient in Dallas, or she's originally from Dallas, who wrote an accompanying editorial to this paper in CJASN. And her experience really sums up what I've been trying to talk about, although quite a bit more eloquently. As a patient with kidney disease, most of my days I'm in a constant fatigue state. How can I exercise when I'm already tired and short of breath? During those times, my body will not allow me to exercise when simply walking from one room to the next has already elevated my heart rate. Maybe we need to redefine exercise. Although there are standards that have been set forth, we also have to consider that some activity is better than none. So I'm running low on time, but I will summarize the points that I hope to get across. Exercise is an effective means of improving physical components of quality of life, walking, and strength, and potentially can be used to ameliorate symptoms of restless legs and depression. Patient pull will ultimately change the culture. It has done so for research, and I believe it can do so in your own clinics if this is something you're interested in, to be vocal. If we want to promote exercise participation, we also have to promote education on symptom management, particularly fatigue, which is a known barrier. And we need some ongoing innovation. We've been proud of ourselves for putting exercise in a few of our dialysis units, but we really need to look towards the home because we know that's where the patient preferences are. We need to look at novel things like fostering community to develop social connection. And finally, in the words of Nicole Jefferson, understand that all movement counts and set realistic goals with the patient. So thank you for your attention. I just wanted to put down these resources. These are a few online resources for people if they're interested in looking at specific exercise advice. And then there are two organizations here. I'm a part of the top one, and really our goal is to improve the quality of research that's happening in exercise. And we are always looking for patient partners to be involved with our organization as well. So thank you.
Do we have any questions in the room for Dr. Thompson?
I have a platform vibration machine.
Sorry?
A vibration platform.
Oh yes, yes, I'm aware of
vibrating.
Yes. Yeah.
And I was just wondering what, if it's okay. Well, I've used it, so it must be okay. And I'm stage 4. But I'm just wondering what your comments would be on using such a machine, because it's in my house. I can get up and can do it in my jammies, you know, and I can do it at night sometimes just sitting on the couch. And I'm just wondering if it's actually effective.
Mm-hmm. I guess that's the question, is what you want to use it for, you know? So what do you want to use that for exercise? So so what I would say about that is that we don't know that that would improve fitness. I certainly couldn't see if you wanted to be fitter, I don't think that there's any evidence that we know of that can actually improve your cardiovascular fitness and so on through with those machines. It hasn't been studied very well, but I know they are popular, and I think they're popular. People like using them, right? And I think that that's a good enough reason to use it. But I can't tell you that you will improve your fitness by using it, if that is your goal. Circulation. I'm not aware of any studies that look at the circulation. I think some people anecdotally do find that it improves the circulation of your feet, and then I would say go ahead and use it. I wouldn't necessarily recommend it to somebody who had poor circulation, but if somebody found that it did, I would say continue to use it.
Now, as well as the people in the room, there are several hundred people online. Catherine, do we have any questions from the online viewers?
Yes, yeah, we have some great questions. So someone's asked about exercise in stage 4 kidney disease and kind of guidance around how much they should be doing. They've asked about should one be guided by their heart rate or something else?
Yeah, that's a really good question. So again, I really believe in sort of individualizing the prescription. So it's hard to say what to do unless you know where someone is starting from. But a very easy way to do it is not to use heart rate so much. I think it's easier because it's relative to your own fitness, is to sort of use a scale of 1 to 10. So with 10 being very, very difficult exercise, the vigorous exercise, and to aim for about a 4, where you could still carry on a conversation with somebody, but that it just may not be easy to talk. So you can finish your sentences, but you are a little bit more labored in your breathing, because that's more in the moderate intensity of exercise. And to try to build up, you know, if you aren't doing anything, you can start with 5 minutes and then move up by about 2 minutes every week or so, something like that. It is hard to give that advice without knowing the person, but I do think things like, they call it the talk test. If you want to look into that further, it's very practical. The other thing I talked about was perceived exertion, which can be a little bit more hard to get your head around if you've never worked at a 10 out of 10, right? Because that's quite hard. And a lot of people don't have the reason to do something like that. So I really like the talk test.
Do you want me to say the other one?
I think that we might be out of time
Okay.
there. Okay, thank you so much.
We also have some